You mentioned that in your previous pregnancy you developed preeclampsia around 32 weeks and had to have a C-section because of it. And this time your doctor said that you're a good candidate for a VBAC, and it sounds like you're about 36 weeks along at this point and haven't developed preeclampsia again, so that's good. Now you're wondering how far your doctor's going to let you go before they just opt for another C-section because the risk is too high for women to be induced after they've already had a C-section. So like you mentioned, doctors don't usually induce women if they're trying for a VBAC because the risk of uterine rupture is too high. 41 weeks is the cutoff because at that point the placenta is starting to get old and it's not feeding your baby as well, and there are other risks associated with it, especially if you're a VBAC. So 41 weeks is your ultimate due date. I'm guessing that's the farthest the doctor would let you go. But it would be best for you to talk with your doctor because, of course, based on their knowledge of your situation, they'll be able to give you the best information about what their intentions are for your pregnancy. One other thing to consider is the fact that you had preeclampsia in the past, and so that means your risk of developing it this time is higher than it would be for a woman who didn't have it with her first pregnancy. And if you started to develop it again, the doctor would probably just do another C-section at that point. So it might be one of those things they just play by ear. They see how your blood pressure is every week at each appointment, and then if you start contracting and go into labor on your own, then great. But if you haven't, again, 41 weeks probably is going to be that cutoff for you. Good luck with everything, and if you have more questions for me in the future, please feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.